Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamu-alaikum and a very warm welcome to World This Morning. I'm your host Hajra Satti and joining me is my wonderful co-host Fahim Bangesh. Assalamu-alaikum Fahim. Juma Mubarak to you and everyone out there. How are you doing today?
Walaikum assalam and Juma Mubarak to you too as well and everyone who's watching us. I'm very well, thank you. And Hajra, I was thinking yesterday while sitting at home, while watching television, how the news that we watch every day is so depressing, how what we are doing in everyday life is slowly and gradually making us into people who have somewhat of a borderline depression or anxiety.
Right.
Because it's the things that we watch, the visual representation of the things that we're watching, be it the films, be it the drama industry, everything is making us more and more anxious. And don't even get me started in the news, because obviously
that's very true, and you have hit the I would say very right chords when we are starting this program early in the morning, and that is why the Reuters digital report mentioned that a lot of people are turning away from the news, and one of the reasons cited was because of this gloom and doom scenario, and because of the ratings. Behind the logic is obviously the ratings, because that is why the journalism industry is in serious crisis, and you will find that the young people, Generation X, they are turning away from the news industry. And I think that is the moment that we, the people who are in the journalism industry and news industry, we need to rethink our approach of how we approach the news and how we design the news in the first place. And you alluded to the fact that when you were sitting at the home, and home is a space or sort of a physical space, or I would say mental space, where we feel very safe in the first place. And for him, let's imagine for those people who cannot feel safe in that particular environment, and they are facing the dispossession and whatnot, and this is what the Palestinians are going through now when the Gaza is under the siege. And it's not just under the siege because Israel has cut off the electricity, Israel has cut off the water supply, there's no
food
aid,
supply,
which is
medical supply.
Exactly.
It's something that's unthinkable right now, because imagining ourselves living in such a condition, I think we can't even start to imagine, because there are so many elderly people in our families who are on a daily medical dosage of something or the other, something really common like diabetes or hypertension. These are the most common diseases of Pakistan, and they have to take medications every day. Imagine them not being able to take medications. That's like a direct loss in front of your eyes, direct wasting away of people in front of your eyes.
And that too, when the population consists of 22 lakh people or 2.2 million people, which are living in a very small strip. It's very densely populated area.
They say it is the most densely populated area.
Exactly. And one of the most open air prisons that have been recorded ever on the earth. So Israeli airstrikes on Gaza Strip have killed at least 1,055 Palestinians, and 4,600 were also injured following 5 nights of intense bombardment by Israel's military in the besieged city. Inna lillahi wa inna ilaihi rajiun. Israeli military confirmed it had hit several Palestinian targets during the night. Dozens of residential buildings, factories, mosques and shops were hit. An energy official in the Gaza Strip said that the sole power plant in the Palestinian enclave is out of fuel and has been shut down. This is the collective punishment that Israel is imposing on the people of Gaza Strip, which is of course in contravention to the international law in the first place. Fears have mounted of a worsening humanitarian crisis in the war-torn Gaza, where Israel has leveled over 1,000 buildings and imposed a total siege, cutting off water, food and power for 2.2 million people.
We're watching in a matter of days, we have watched the whole city. It has been reduced to just a rubble, nothing else but a rubble. And also we heard some doctors saying that the hospitals are going to be turned into mortuaries now very soon if the power supply is not restored. And that is something very disturbing for the mind and for the mental health, for people like us who are already struggling with so many stresses in the environment. And imagine a stressor like this coming up on your television screen and bombarding you with such information. and not just us, the younger population of our country, the older population of our country, which should not be stressed in the first place. I mean, talking about the older population, they are to be kept relaxed as much as possible.
Yes, and Fahim, so let's not monopolize our conversation because this is a very important and a dense topic, and obviously there's a lot that is discourses that are generated, a lot has been going on, a lot of commentaries that have been going on. But since it also happens to be World Mental Illness Awareness Week going on, so we want to relate to how people of the war-torn countries or people who are suffering or going through that particular very stressful environment of the disposition of the war, how they are going to recuperate, or are they coping up with such a stressful environment, and that too particularly of the Palestinian people, Gazans. We want to talk about it. So without any further ado, we would like to introduce one of the very graceful personalities who happens to be in our studio. She's very well versed and she's a true beauty with the brains. We are very glad that we have been joined by Dr. Rubia Osman. She happens to be a family physician, and she's going to obviously talk about the mental illnesses and the impact of mental health on the war-torn country of Gaza. Assalamu alaikum, Dr. Rubia, and thank you so much for coming to our show.
Thank you for having me.
And a very good morning.
Thank you. Good morning to you.
Now, Dr. Rubia, we know that mental health is something that is called a universal human right, and something that I would say a majority of the population of the entire world is suffering from these days.
Right.
Bad mental health. Especially talking about war-torn areas, because all over the globe we see conflicts, we see something or the other happening in one place or the other, be it a natural disaster, a man-made disaster, conflict zone. So the one most common thing is PTSD, and which affects not just the children but the adults and the elder population. Could you highlight the effects of the PTSD and also explain PTSD to us and the viewers?
So basically what happens is that a person goes through a trauma of any kind. That can be physical trauma, emotional trauma, mental trauma, and that trauma, we have different ways of dealing with it. So what you may do is you may pretend that it's not happening, so you may go into complete denial mode. You may kind of like want to confront it, and you may want to take it up by the horns and say, you know what, this is what the problem is, let's sort it out. Or you may think you've sorted it and it may become an unresolved issue which will stay with you for the rest of your life. Either way, however you deal with it, you realize that it impacts you in a lot more ways that you've actually imagined. So you may be more hyper sort of sympathetic, you may react much more to certain situations. So people who've been in war, for instance, even when there are fireworks going on, they can't tolerate it, they just cannot put up with it. So as for an everyday person, simple things like that can affect them. Because what happens is that their reaction to things is so heightened that when there's something like simple happening, their body immediately goes to the worst case scenario and they go into protective mode. Then the other thing what happens is it shows us other ways like of aggression. So what I've seen a lot is that a lot of patients don't know how to deal with their emotions, so they become aggressive. They get agitated in even simple situations. So simple things like getting late in the morning for work, and then you just start getting more aggressive rather than staying calm and just thinking, you know what, it's happening, it's going to happen, let's just deal with it. So your capacity to deal with your own emotions is almost gone. There is emotional numbing as well in certain cases. So you might become a complete robotic personality and your family might suffer because of that. But just सबसे interesting बात है, the funniest and the most interesting part is PTSD was not even recognized as being a mental health issue till like 1980.
Right.
So you've had a whole generation of people who've had World War I, World War II, Cold War, all kinds of wars have been going on, Vietnam War. The list is endless and really sad and sorry. But nobody recognized it. So you had all these soldiers who were coming back from war with all this trauma and all these kind of like weird physical and sort of psychological issues, but nobody could recognize what it is or put it in a box. And you were just sort of like, you know, just getting on with life and just dealing with it. Now, thankfully, there is awareness.
Right.
So we know what it is, we can give you treatments for it, there are psychotherapies, you can go to your psychiatrist, there's medication, there's all kinds of help available.
But also, Dr. Saiba, there are some people who mention that a human mind, who don't have the know-how or the awareness of PTSD, they say the human mind is so powerful that it can perhaps, you know, adapt to the ongoing changes of the neurochemicals in the brain, or perhaps, you know, get over that, because when we talk about relationships, we say, okay, perhaps you'll get over this in a couple of years. But PTSD is something totally different.
And this is not something you can just get over by just, like you said, just like talking about it and forgetting about it and pretending it didn't happen. It doesn't work like that. Seeking therapy is very important in this situation, and ignoring it unfortunately only leads to more adverse outcomes later on. So it can impact our physical health. The mental health is just a part of it. There's so much more to it. You can start having issues that, like you mentioned, you know, things like diabetes, hypertension, we keep ignoring them. Stress is such a contributing factor to that.
True.
So, you know, we are growing old as we are aging. So all of this is going on alongside your mental health issues. So your body is also aging. So this will impact you in multiple ways.
Right. And Dr. Rubia, since this war started, the Gazan war, and there was lots of conversations going on the social media, and I came across one of the research which was conducted by the FENN, and it talked about, and he particularly researched the Algeria and how the French occupation or colonization impacted psychologically the people there, right? And it talked about that how colonial subjects were constantly told that they were inferior beings, and this led to the self-hatred and depression and all of these, you know, mental health and psychological issues. But when we talk about the Gaza conflict in particular, I don't think so this is the case that has been going on there, right? Because there's lots of resistance going on, and the people they're operating from a position of such extreme anger and frustration because they have been colonized, they have been dispossessed of their home, there's a settler violence going on, but still the resolve is more brighter, we would say, determined, right? But obviously children are suffering there in the particular.
So a lot of our research is historical. This I really want to stress.
Right.
With historical research, what happens is that a lot of things become more apparent later on, and they become part of our history really, if you think about it. Things that happened half a century ago or a century ago, and it's over. There are two important elements to it. So that war is no longer a war. Like Vietnam, for example, I'll give you an example of. It's no longer a war, and all this new information is coming, old information is coming, and that is becoming part of our history.
Right.
And now we're talking about discussing it. So that's different. This biggest problem with current wars is they're happening right now.
Right.
So we're living them as we, so you're living it, I'm living it, our children might be seeing it, everybody's looking at it and seeing it. And the impact it's having on not just the people who are going through it, but everyday man. So social media is something really interesting that you mentioned, and I want to talk about this.
Sure.
There is something they're talking about, doomsday scrolling. So what's happening now is that there are clickbait articles on social media. So the article which is catchy, so if there's an article which says that there's a bison which will be completely, you know, like which is going to go out and go extinct in the next 5 years, you will see it, you'll read it, it will make an impact. If there's a research somebody publishes about the animals going extinct, nobody's going to read about that. So war is exactly like that. So when you read about war, you read about the suffering, especially if there are children involved, it just touches the chord, doesn't it? So what people are doing is they're creating more sensationalization news, and war doesn't need any sensationalization.
And pictures and videos, not to forget.
Exactly. And the thing that I want to talk about is this. What I have seen is, and not just like I'm talking about like Facebook or Instagram, but like your WhatsApp. Do you guys not realize how many messages we get daily? I have a group, which is my family group, by the way, and incessantly my family is sending me all of these videos, and we're like, I don't want to see this anymore, please stop sending them. And these are really sad videos. These are really, really tragic videos. And we are being bombarded with all this information. So one of two things will happen. One reaction is that you will get angry and you will be really upset, and you may react in various different forms of anger and being upset. The second thing is emotional numbing or desensitization. After a while, you'll be like, you know, ye to har jagah ho raha hai, this is the norm, and how does it really impact me? Let me just get on with my day and my life and my work. And neither is a good place to be in.
Right. But Dr. Rubia, how can we cope up with this situation? Because social media is such an important fabric of our personalities, because we can't be away from social media. It is an important source of the news too, I would say.
And shopping.
Of course, and shopping. But obviously then we have to make sure that we are more media literate when we are interacting with the social media. So from our platform as a doctor, how would you suggest that we interact with the social media, and especially, you know, not to get too much desensitized about topics?
So you need to look after your mental health. This is something that I really want to stress on. You, as a person, as an individual, we all have a responsibility to only share information that is legitimate. So first of all, misinformation or disinformation is another problem.
Right.
What's happening now is you're seeing something, someone starts a thread, nobody wants to verify it, nobody wants to check it, they start sharing it.
Nobody has the time.
Nobody has the time.
Usually.
That is true. And then before you realize it, it's actually like multiplied and escalated and has been shared on so many different platforms. So there are few news information that are coming through via Instagram, via WhatsApp, via Facebook, it's everywhere. So you can't physically avoid it. The only little thing that I will advise everybody is, listen, I know it's really hard, but don't trust everything that you read. Try to make sure that you read credible news channels. So I would probably just read the information from a news channel like yourself, and I would believe it because you would have verified it. So a clickbait article doesn't care about verification. All they want is for you to just click. Once you've clicked that, their job is done.
Because usually when I get the information, some information or the other, my first question, please tell me the source.
Exactly.
Yeah.
Exactly.
So
and that's
exactly
just
what
a
you
very
said.
simple thing. And it's hard. I agree with you, in a busy day it'd be hard, but like after a little while you'll start realizing, yes, these are legitimate sources of information, and these are just things to just lure you into an argument with a stranger. So don't be lured into arguments with strangers. I also have a pet peeve which I don't think people realize. I sometimes go just for fun and read comments on infuriating articles just to see how people are responding
Reacting to it.
And it's really interesting to see that. So the piece of information is completely different. Half the people haven't even read it. आधे लोग जो कमेंट कर रहे हैं, they have no clue कि उसके information article में लिखा क्या था. But strangers are fighting strangers over he said, she said, this happened, that happened.
But you know, that also tells us the mentality, the overall mental health of the community that we're living in. Because you see, they're not responding to it, they're reacting to it. And also, like you were mentioning about emotional numbness and emotional frigidity.
Yes.
So I was also thinking that this perhaps is leading us to go towards a majority or a mass personality disorder as a nation, not just in Pakistan, but the entire world.
Yeah, and that's sad because we need to stay human. And we won't be able to react and respond to situations because of all this bombardment of information. Our previous generations, they had some information from very few resources. So their issue was the lack of information, perhaps. And like I said, later on when things were over, a lot of history came out, and then you realize, oh, that's what was going on a century ago. This is what happened in World War I. This is what happened in World War II. At the time, people weren't even sure what was going on. With us, we are the generation that has constant source of information all the time. Something happens in another part of the world that you've never been to, you've never seen, you'll know instantly. And you want to be the first to know. That's the other problem. Sadly, there's also this race to be the first to have all the information by masses as well, not just news channels. People also want to be the first to know. When a celebrity passes away, you want to be the first one to tell the rest of the world that I realize that somebody passed away.
True.
So it's one of those things. It's a race, and that's sad, but I think we should always be positive. Looking after your own mental health is very important. Recognize, when I was preparing for this show today, I went through some information and I realized, like for example, there are 40 current violent different wars going on in the world. I had no clue about this. I was like, इतने मुल्क दुनिया में जितने हैं उससे ज़्यादा तो जंगें लग रहा है हो रही हैं. मतलब what is going on really? And I was researching and I was trying to read which countries they are. And some of the countries in Africa, for instance, I wasn't even sure where they are. But the point what I'm trying to say is that made me realize about my mental health. After a couple of hours of this, I had to detach myself from that because I couldn't read about it anymore. It was just too upsetting. So we need to be aware. I think that's the most important thing.
And also, Fahim, I've always maintained this thing that social media always rewards mediocrity. Like you mentioned about the fact that people are fighting and people are such a mediocre level that they are interacting with each other, that you will not find very intellectual discourses on the social media. And because of the short attention span, the short time that we have attuned ourselves to, I think there's lots of wealth of information, but I would say that there's a disparity of the I would say good wisdom or information that we could find on the social media.
Because like you said, the philosophy remains somewhere behind, and there we are abusing each other. There we are talking
complete strangers.
Nonsense about each other, and that's exactly mediocrity.
That's exactly, and obviously war dehumanizes enemies a lot, right? This is how the war works. But in the post-war period, especially when we talk about Gaza, so you've talked about the PTSD is one of the problems when it comes to mental illnesses that they are going to face. So what are some of the other problems, and how can they recuperate in the aftermath of the war?
So the trauma of it, I don't even know. I don't think I can even talk about it. I'm such a small person to even comment on such a big issue really. But one of the things that I was also thinking about was radicalization. So as part of our NHS training, we're always told to prevent and look out for these kind of traits and scenarios in people. How do you do that in a situation where the whole country is at war? So in a country where I was working, where I was at, it was a bit easier for me. Well, easy though I wouldn't say, nothing is ever easy in our profession. But at least I was trained to look after signs and traits in the younger population about grooming, about radicalization, and what puts them, the vulnerable people at risk. So there are different groups. For example, teens, for instance, will react completely different to how you might, Hajra, or how I might. A teenager might not understand, but will have a very myopic view and will get a little bit of it. We need to look after our children's health through that way as well. I think it's very important to talk about that. When people have lost a lot, it's very hard to talk to them and rationalize with them and reason with them.
Yes.
So how do you reason and how do you prevent radicalization in somebody who may have lost their entire families, for instance? It's a really uphill task.
Of course.
And I don't even know whether we are ready and prepared for it, to be honest. Doctors Without Borders, and I do want to mention them, this show would be incomplete and I would not have done my job.
course.
There are other ways for us to help. So there are agencies who are sending help to these war-torn areas. We don't have to be keyboard warriors. We don't have to just sit there, hum ghar se baithe lad mar rahe hain saron se. If we have something that we can do to help, we should help. That doesn't necessarily mean that you pick a side and you say this is my side, this is your side, you're wrong, I'm right. It means that you just find ways to help. So Doctors Without Borders sends doctors in all these war-torn and famine-torn countries, and all of these places where there are natural or man-made disasters, these doctors are working tirelessly. 4 paramedics passed away in the latest conflict, and I read about them and that hurt me. And then I thought about it, will it stop people from going to such areas? The answer is nobody knows, because as these bad times come, I also see a lot of good people come.
Yeah.
So you see there's a positive reaction to it as well. So it might bring out, there might be some brave doctors who will say, you know what, I'm going to go to this war-torn area and I'm going to help them out.
Because like you were mentioning, children and teenagers, the teenagers we do see typically have, even in developed areas and non-war-torn areas, we see them as, you know, volatile personalities. But imagine the teenagers in the war-torn areas and also the children. I was reading an article the other day and about the same conflict that's currently underway.
Yes.
And a child said to her father that, am I going to heaven or hell?
Yeah.
A child thinking about that, a 7 or 8-year-old child, that's not something that we're looking forward to. That's not something that we expect from our children. We just expect them to grow their skills, grow their talents.
And be innocent.
And be innocent, right? The
Dealing
childhood
with
is gone.
Dealing with death is another element to any war, basically. There are resources online. Sadly, a lot of times, the thing is, a lot of these things sound so hollow. I was thinking, if you don't have internet and if you don't have electricity, what is the point of me sharing online resources? You won't have access to these things. So I get the frustration, even as a healthcare professional. I feel the frustration. How do I help people who are in need if they have bare minimum? It's easy to help people when they have everything. But how do you help someone who has bare minimum? If they don't have a resource to use my resource, how do I help them with that? So do we have psychiatrists? Do we have psychotherapists? Do we have psychologists who will be there to help these people out at this point in time? Maybe no, maybe not, but maybe in the future years. So like we have institutes which help immigrants. So immigrants who've come from Afghanistan, for instance, and who've relocated, or anybody, asylum seekers. So we have a branch of people who just sit there and helps with them deal with their issues, because they've seen, they've been through their experience, they know how to deal with these things. Perhaps that would be an excellent resource to tap into.
Lovely, because obviously this is something that is a need of the hour, provision of medical care, mental health care, because that is something that is extremely ignored. And like you mentioned, very rightly so, that in a war-torn country there, would we be expecting any mental health care professionals over there?
It would be bottom of the list right now. If you think about it, right now, they need bare necessities. So mental health really becomes like a non-issue, doesn't it? And that's just sad. I feel like sometimes and I didn't want to get all doomy gloomy. I was trying to bring a positive message of hope, and I will try my best to say that. Look, with fear, with problems, we bring solutions. We didn't about PTSD until we saw so much of it.
Yes.
Right.
So the solutions come from the problem, sadly.
But also they say that, you know, you can bear and endure every kind of difficulty that you come across, but when there is no hope, then it becomes very difficult. And then it becomes very difficult to rationalize anything, like you very rightly mentioned.
And the thing with hope is, and I must leave everybody with that. Look, there are a lot of good doctors out there. There's a lot of there are a lot of good people out there. Forget doctors, that's just one branch of society who are trying to help whoever is in desperation and in need. And one of the essential human sort of traits is that we have a protective nature, alpha males. So Pakistan is a patriarchal society. I'm always irritated by that, and it annoys me as being a female, obviously. But look, you have to look on the flip side of it. Men want to protect their women. So the point what I'm trying to make is, there will be good people. From all of this bad will come good as well, and they will try to help in whichever way they can. So we must stay positive. I'm going to go back to talking about death. I think that is something really important. We need to be able to have these conversations. What happens in our society by masses, by normal people, like not even war-torn areas, we don't talk about death. When someone, a loved one passes away, we just tell our children, anything, anything from they've become a star
True.
to they've gone to heaven to they've gone to
Angel,
Nani
yeah.
Dadi's house or somebody else's
Yeah.
house. So, you know, like there's all kinds of stories being made. I think it's important to just read up a little bit about how to talk to your children about death, how to deal with death yourself. Our generation, so we are people who are in our middle ages now. We are losing our parents at this point in life. We're all in various stages of it. We're
Right.
seeing them get elderly and frail. I see people like us struggling to deal with death. I see it every day. So if you feel like you're struggling to deal with death of a loved one, just seek help. Speak to someone who knows what they're doing. Speak to, just speak, communicate. I think that's the other problem, isn't it? Lack of communication.
That's
True
true.
that.
That's
Dr. Rubia, you put in and highlighted some very pertinent issues and points that I think we should talk more about. And I think the message of hope that you gave, that's also very important, and beautifully you put it. And I must appreciate it, and I must thank you for taking out time and coming in here in our studios and gracing our show with your presence.
Thank you.
Thank you very much for coming
Thank you.
here.
Thank you so much.
Thank you so much, and we would like to wrap up our segment, and in the coming segment we are going to talk about another important issue, and obviously since it's October, so it's also the Pinktober month, but don't go anywhere. After a short break we will be right back. Good morning.
Welcome back to World This Morning with Hajra Satti and Fahim Bangish. And in the first segment, we were talking about something really, really serious. And in the second segment, as we told you, we're going to have a very productive discussion. And of course, as we all know, that this is the month of October, also known to be as Pinktober, because this is the month in which we observe the breast cancer awareness. It's observed to be as the month of breast cancer awareness. And also, this is something really, really pertinent and something that is perhaps preventable, something that is perhaps treatable if detected at early stage. But since we're talking about awareness, we have someone really important and interesting in the studio. Hajra.
Right. So without any further ado, we would like to introduce a very worthy guest who happens to be Dr. Hira Asim. She is an oncologist, and she will obviously talk about the breast cancer awareness. Assalamu alaikum, Dr. Saib, and thank you so much for coming to our show.
Thank you very much. Good morning.
And
Thank
good
you for the
morning.
invitation.
Of course.
Pleasure.
So Dr. Saiba, since it's obviously Pinktober, and there's lots of conversations going on the breast cancer awareness, and obviously whenever we talk about the word cancer, it is such a doomy and gloomy sort of a word that it gives us a very, I would say, goosebumps that, you know, the death is going to happen. And the way it is projected in the movies, in the pop culture, you would always find that, you know, at the end of the drama or any movie that the person is going to die, right? So how dangerous or fatal is this particular cancer, and what do you have to say about it?
So you're very right that there is a taboo attached to the word of cancer. So whenever somebody is diagnosed with cancer, they feel that this is the end of life.
True.
So, and this thing has been so established in people's mind that they're not going to change it.
Right.
So even if we counsel them, they have this thought in their mind that this is a dangerous disease and they're not going to live. So yes, cancer is a disease like other diseases like diabetes, like hypertension, but we know that this disease also has its treatment available.
Remedies available.
So if it is treated in a proper way, and especially as you mentioned in early stages, it can be cured, and even in the later stages it can be stopped, or it can be the symptoms can be delayed, the life can be prolonged.
Right.
So so like for diabetes, for hypertension, people do take medicines for a long time and they don't complain, but for cancer, if they are supposed to take medicine for a long time, they don't like it.
Right.
So so it's just the unfortunately stigma attached to the disease and its treatment, and so that's why people don't accept it the way they accept other diseases. so generally what we do is we do counsel everybody, and especially during this month, during all the awareness sessions we hold during the year as well, we do try to change the perception in the people's mind that this is a disease like other diseases. Treatment has been changing. The treatment is more effective now, and there are certain cancers, especially breast cancer, there are very effective treatment options in all stages, and it is not the end of life. So, and I think these are the programs that that can help in changing people's perception in general.
Also, Dr. Hira, like you're an oncologist, it's brilliant that you are. There are some people who have a genetic predisposition towards cancer, and are there any perhaps mitigation strategies that one can go through the testing or having something done in order to prevent it in the future?
Okay, so first of all, we need to know that only minority of cancers are genetic cancers.
So
only minority of breast cancers are genetic. So in our world, people say that if the mother has cancer, the daughter will also have cancer. But we must understand that 95% of cancers are sporadic; they are not genetic. Only 5% of the cancers they can run in families, and they are genetic. And yes, we do have tests wherever we see the possibility of a genetic cancer. We do run certain tests to establish that yes, this cancer is genetic cancer. And once we have established that somebody has got a genetic mutation which can lead to cancer in future, we do offer, depending on the age, we do offer screening test, or screening duration is different for patients who have genetic predispositions. So the screening is more frequent. Then at a certain age we do recommend them certain treatments in the form of surgery, in the form of preventive medicines. So, so yes, they are less in number, but we do need to look for these type of cancers, and we can detect them early, and we can also prevent them if we know that somebody is a carrier and there is a tendency to develop cancer in the future. So we do have certain treatments available.
Yeah, go ahead.
So Dr. Hira, we've also seen that especially people who are going through breast cancer and their treatments in the form of chemotherapy. So there's a very radical reshaping of identity which is going on, and people who look themselves in the mirror, they see that their weight has shrinked and their hairs are gone, and obviously it's a very difficult treatment, and their entire personality physically has changed, right? So how do you think we need to approach to these patients which is more sensitive? So how can we be more, because
and to add on to that, Hajra, especially when after treatment, if they get a mastectomy done, then that also affects their overall image and self-esteem a lot.
And because I think in being a Pakistani, and I've seen this approach a lot in our society, the way people approach this topic, not intentionally, unintentionally, they might be having the conversation that is adding more depression to the patient, right? About the deaths, and you know how they're explaining this entire concept to that, which can be very, very give them anxiety or depression. So how do you think we can be more sensitive?
Yeah, you're very right. I think this is very unfortunate. So the first question first. Yes, we have different treatments which include surgery, which include chemotherapy, radiotherapy, and every word has its own stigma to it. So, so if you talk about surgery, yes, people do undergo mastectomy. Certain patients have to unfortunately undergo mastectomy. But we do is, depending on the patient, we do offer them immediate reconstruction at the same time. So with reconstruction, the cosmetic results, they are very, very feasible and good. And good. So with reconstruction, majority of the patients who undergo this procedure, they are very happy and they are very satisfied with the cosmetic outcome. Similarly, during chemotherapy, yes, there is hair loss, there is change in weight, there is overall change in body appearance. But what we usually do is we do keep counseling the patient during treatment. They are constantly in touch with us. They see their doctor. Then the family is there to support as well. So during this treatment, we do in every visit we do counsel them that this is only a temporary phase. You will get hair loss, it will recover, this is only temporary. So they actually pass through that phase with our counseling, with family support and everything. But yes, you are very right. When the problem is when they complete their treatment and they go back to work and they go back to the society, what we feel is the doctor's visits are reduced. Like we see them very frequently during the treatment, but after treatment we give them like 3 months or 6 months follow up. So during that period we see that most of our patients they end up in depression because they go back to work, people do see them differently. They go to the society, they go to different they meet their friends, they have different discussions. So this actually affects their mental health.
Right.
So what we do is we do start in our country as well, and in our hospital we have started breast cancer support groups where we let patients meet each other and they share their problems with each other, and they help each other how to cope with all these. So there are certain patients who are more stronger than the other ones. So they help each other in a way, and then we also do join them during that activities along with a therapist, along with a psychologist and psychiatrist, so that we can help them in their life after cancer as well.
So it's a total holistic approach.
Yeah,
Lovely.
true.
Also, they say that regular mammography is to be done for basically they talk about it for all the women there. What is the minimum age that someone should go or even think about getting a mammography done?
So mammogram is a very simple test. It's like an X-ray, and it is generally recommended for women who are above 40 years of age.
Above 40,
yeah.
Right.
So it is done every year after 40 years of age.
Right.
But there are certain situations in which a doctor may recommend mammography between 35 to 40 years of age as well. So it between that age, it is entirely on doctor's recommendation.
I see. And also, when we talk about cancer, we just say it's an abnormal growth of cells, right? But then what can we say is responsible for that abnormal growth? You said there's a quite a rare percentage of people who have this genetic predisposition, but what about the rest of them? Because is it what we eat? Is it the environment we live in? Is it, what is it basically that causes it?
Okay, so the basic cause of cancer, or the basic reason to develop cancerous growth, is the genetic change. So there is some damage to the DNA that make the cell abnormal, and the cells start dividing, and there is no control to their division. So normally in the normal healthy cells, what happens is if there is any cell which is abnormal, the normal body cells take over and they kill the abnormal cell, and that growth is stopped. But in cancer, what happens is that the abnormal cells keeps on growing, and the normal mechanisms, they are weak, they are unable to stop that growth, and these abnormal cells, they grow, they divide, and they form a clump of cells which is called a tumor. So the reason why this genetic change occurs could be manifold. So as we discussed, that in minority of patients it is genetic mutation, but in majority of patients it is other than genetic mutations. So it can be just change in the lifestyle. It can be just change in the environment. So there are some carcinogens, or the cancer producing chemicals or cancer causing chemicals in the environment which the person is exposed to. There are certain chemicals causing cancer in the food which the person is exposed to, and then there are certain metabolic changes or hormonal changes which are going on in the body as well. So if those hormonal changes, they are abnormal, they can also change, they can also cause that genetic change in the cells. Similarly, if we are taking certain drugs which are overuse of drugs, or certain harmful drugs, or which we are taking for a long time, for example, if like oral contraceptive pills, if you are taking them for a long time, and like postmenopausal women who take hormonal replacement therapy, these are also chemicals. So if we are taking them for a very long time, they also have the tendency to cause abnormal change in the cells and eventually cancer.
Right. So Dr. Saiba, we have seen that there are lots of feminist narratives regarding breast cancer awareness, and there are lots of conversations going on. But do you think that we have achieved the awareness that is required for the women to go out and get themselves tested? And what sort of conversations do you think we need to have in order to further explore this particular topic?
So I seriously think we haven't gone to we haven't touched 5% of the awareness level yet.
Okay.
So the reason is, when I sit in the clinic, I still see patients coming with a huge lump, with a bleeding tumor, with a fungating tumor, which they have been keeping for a long time. And these women, they are not those women who are living in a far-flung area or in a village. These are women who are living in this city, in the capital city of Islamabad.
Because sexuality of women is always a taboo subject, right?
Yeah.
Yes.
So so these women, they these are those women whose family have doctors. Their children are doctors, but still they're hiding.
Right.
So I think there is a lot of work still we need to do. And we have to conduct such programs, awareness session, and we have to make our women comfortable to talk about these issues, so that if they feel any change in their body, they are able to speak to their family, to their children, to their husband, and then they should also have the comfort to know that if they go to the hospital, they will be dealt in a way they want to. So I feel that certain women, they don't come to the hospital, that they will have to see somebody who may not respect their privacy, male aside, but even sometimes they're reluctant to see a woman doctor, that they don't want to see anybody, they don't want to be examined by anybody. So it's very important that we need to be very gentle with them. So like I see some women who go to some doctor, they are treated in a different way, and then they don't go to anyone. They just keep on hiding because they said that they are not getting the doctor they want. So it's very important that when these women, they are open and they are coming to us, we treat them very gently. We respect their privacy, we give them that comfort to speak to us, and eventually we slowly counsel them towards the treatment. So I think this is a very sensitive issue, which we should take in a more responsible way.
So usually what I see which is happening is, whenever there is a mental health observance month or week, or breast cancer awareness month a week, we do see seminars in big hotels, we do see advertisements being run on television. But don't you think the common people should be called into such seminars being held in different public places to create actual awareness in people? Because it's not like every person is going to take an advertisement very seriously when it comes to health. Or usually in the seminars and workshops, mostly it's just the doctor community over there, right? Or a very educated community over there. But even in the cities, there are communities, like you just mentioned, they are very shy, they are very reluctant, and they don't really talk about it. So to encourage them to talk about it is something that's need of the hour.
Exactly.
And this is something that should be done on a mass level, public level. So in this breast cancer awareness month, what would be your message to the government, to the authorities? What should be done in order for people to get the awareness that they have to?
First of all, I would say that these campaigns that we run, they should be more intensified. Like they shouldn't be reserved for the month of October. They should run throughout the year, because this is the leading cancer in women. This is the leading cancer in the world. So and the women are dying because of these. So I feel that the campaigns should be should run throughout the year. They should be more intensified, and all kind of media should be used. Like they should be social media should be engaged. The television, newspaper, all these media should be engaged. And then in addition to that, there should be lectures held at the common places. Like we do give lectures like in different universities and certain bigger universities, but I think we also need to cater the colleges, the local colleges, and then also the teachers as well, because we do see that a teacher can influence their students a lot. So if we counsel the teachers and we make the teachers aware, that is going to help in the longer run as well.
And ma'am, even in the religious seminaries, I think they're also the most important part of the society, because like you said, students listen to the teachers. They also follow blindly only the teachers in the religious seminaries.
Community,
Exactly,
the community members and local
Yeah.
community
True,
members. So thank
true.
you so much, Dr. Saiba, for coming here, for having this wonderful discussion on the breast cancer awareness. And the one thing which stands out in this conversation is that we need to be more forthcoming about this issue. And obviously, the sexuality of women has always been a taboo subject, but I'm really glad that the conversations such like that we are having now made dent that particular stereotype about the sexuality, because obviously your health always comes first and your health should be a priority.
Of course.
So with that, we will say Allah Hafiz. Until next time, it's a goodbye and good morning.